Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. The Honorable Lecturer, Madam Nursaptaningsi, as whom am home, and all of my beloved friends. First of all, let's say thanks to Allah Subhanahu wa Ta'ala because His blessing, we are able to come here to join in this English meeting. Ladies and gentlemen, the presentation today is about the respiratory system from Group 4. Now I will read one by one our agenda today. The first session is opening, the second session is introduction, the third session is presentation time from Group 4, and the last session is closing. Well, ladies and gentlemen, let's open our meeting by saying Basmalah together. Bismillahirrahmanirrahim. Thank you. Before we start our presentation, I will introduce my team. Okay, next. One adalah Ayu Amelia Putri Kusnanto, two Ataya Sabrina Sofa, three Fasya Rizky Nurfadila, four Christina Elizabeth Gultom, five Mutia Mufida Rahma, six Ria Rahmawati, and seven Umi Haryati. Thank you. For the next agenda is presentation session. For the first turn will be given by the first speaker. Please welcome my friends, Christina.
Okay, thank you to moderator. I will explanation a little about the respiratory system. What is respiratory system? The respiratory system, the network of organ and tissue that help you to breathe. It includes your airways, lungs, and blood vessels. Your respiratory system is the network of organs and tissue that help you breathe. This system helps your body absorb oxygen from the air so your organ can work. It also cleans waste gas such as carbon dioxide from your blood. Common problems include allergy, disease, or infection. What does the respiratory system do? This respiratory system has many functions. Besides helping you inhale or breathe in and exhale or breathe out, it number 1 allows you to talk and to smell. Number 2 warms air to match your body temperature and moderates to the humidity level that your body needs. Number 3 deliver oxygen to the cells in your body. Number 4 removes waste gas including carbon dioxide from the body when you exhale. Number 5 protect your airways from harmful substances and irritation. What are the parts of the respiratory system? The respiratory system has many different parts that work together to help you breathe. Each group of parts has many separate components. Your airways deliver air to your lungs. Your airways are a complicated system that includes your number 1 nose. Nose opening that pull air from the outside your body into your respiratory system. Also known as niche cavity is the main internal opening for the respiratory system and are the fifth section of the body airways, the respiratory tract through which air moves. The function of the niche cavity is to warm, moisturize, and filter air entering the body before it reaches the lungs. Hair and moonshine, the niche cavity helps to trap dust, mold, pollen, and other environment contaminants before they can relates the inner portion of the body. Air exciting the body through the nose reject moisture and heat to the niche cavity before being exhaled into the environment. That's all my explanation. I'll return to moderator. Thank
Okay.
you.
Thank you, Christina. Next turn is for the second speaker. For Mutia Mufidarahma, the floor is yours.
Okay, Fazia, thank you for the time. The second part is mouth, is the secondary external opening door. The respiratory tract can be used to supplement or replace the nasal cavity's function when needed. Because the pathway for air entering from nose, the mouth does not warm and moisturize the air entering the lungs as well as the nose too. The mouth also lacks the hairs and sticky mucus that filter air passing through the nasal cavity. The one advantage of breathing through the mouth is that its shorter distance and larger the diameter allows air to quickly enter the body. The third part is pharynx, also known as the throat. Because of its location, the pharynx helps the respiratory system by allowing air to make its way to the respiratory tract. For digestions, the use of the muscles surrounding the pharynx, both circular constrictive muscles and longitudinal muscles, work together to send food and bring down to the esophagus. The circular muscles push food and bring down to the intestines, while the longitudinal muscles widen and lift the pharynx, which is what makes it possible to swallow. The last known function of the pharynx is its role in speech. Because the pharynx is an enclosed space that can change shape thanks to its musculature structure, air is able to travel through the pharynx to the larynx or the voice box. As vocal cords work to make sound, the pharynx is able to amplify that sound as the larynx opens up into the pharynx. Thank you.
Okay, thank you, Mutia. Next one is time for third speaker. For my friends Ria Rahmawati, the floor is yours.
Sinus. The sinus helps the voice resonate and can avoid the way we perceive someone speaks. The walls of the sinus cavities keep the tissue moist and healthy, also trap bacteria. The mucus help humidify and filter the air. The sinus cavities are lined with soft tissue and they're usually empty. The walls of the tissue cavities are likely contained with mucus, which keep the tissue moist and healthy and also trap bacteria. Next. Larynx, also known as the voice box, has several functions. 1. Speech production. 2. Air passage in the respiratory system. 3. Channeling food into the digestive system. Also known as the voice box, is a short section of the airway that connects the larynx and the bacteria. Location in the anterior portion of the neck, just inferior to the hyoid boyd and superior to the structure. Next. Sorry. Thanks for time.
Okay, thank you, Ria. Next one is time for the fourth speaker, the third speaker. For Ataya, the floor is yours.
Okay, Next is the trachea. Its function is 1. To transport air to and from the lungs. 2. Helps even against disease. 3. Helps capture microorganisms such as virus and harmful bacteria before they enter the lungs. 4. Helps regulate the temperature of the air coming in and out of the lungs. 5. On cold days, helps warm and provide humidity to the air before it reaches the lungs. On hot days, helps cool to the air through evaporation. The trachea or windpipe is a 5-inch long tube made of C-shaped hyaline cartilage rings lined with pseudostratified ciliate columnar epithelium. The trachea connects the larynx to the bronchi and allows air to pass through the neck and into the thorax. The rings of cartilage making up the trachea allow it to remain open to air at all times. The open end of the cartilage rings flash posteriorly towards the esophagus, allowing the esophagus to expand into the space occupied by the trachea to accommodate mass of food moving through the esophagus. Next. The next is bronchial tubes. Its function is 1. To carry air to and from your lungs. 2. Help moisturize the air you breathe and screen out foreign particles. 3. Keeps your airways moist, also traps bacteria, virus, fungi, and other particles. The bronchial tubes are really just like small hoses. They branch out from the trachea to take air to the lungs. When they reach the lungs, they split out into smaller branches, called bronchioles, which then connect to small sacs, called alveoli, which cluster like grapes and perform the actual transfer to oxygen into the bloodstream. The average person has a tennis court of alveoli surface within their lungs, all for the purpose of exchanging gas between the air sacs and the bloodstream. Except the interior of the lungs is made up of spongy tissue, containing many capillaries and around 30 million tiny cells known as alveoli. The alveoli are cup-shaped structures found at the end of the terminal bronchioles and surrounded by capillaries. The alveoli are lined with thin, simple, squamous epithelium that allow air entering the alveoli to exchange its gas with the blood passing through the capillaries. Okay, thank you for the time.
Okay, thank you, Ataya. Next one is the time for fourth speaker. For Umi Haryati, the floor is yours.
Thank you, moderator, for your time. Here I will explain about the diaphragm and lungs. Diaphragm plays an integral role in respiration, breathing. Most of the time, the diaphragm of involuntary also plays a role in helping the movement of muscle bronchiolitis. Having a bowel movement, urinating, and lifting heavy objects also helps maintain the flow of lymphatic fluid throughout the body. The diaphragm is one of the main muscles of respiration. When the muscle fibers form, the diaphragm is flattened. It produces the volume of the thorax cavity vertically, which decreases intrapulmonary pressure, and air enters the lungs. When the diaphragm dilates, thoracic volume decreases, intrapulmonary pressure increases, and air flow out of the lungs. When the diaphragm works with the anterolateral abdominal muscle, diaphragm contraction is increasing intra-abdominal pressure. This is needed when action such as stretch as flowing from it: education, maturation, urination, and parturition. Another function of the diaphragm is that provide a passageway or sometimes structure from the thorax to the abdomen inferior vena cava, esophagus, and aorta, as mentioned earlier. Next. Lungs. The main function of the lungs is the process of diaphragm called respiration or breathing. In respiration, oxygen from incoming air enters the blood, and carbon dioxide, a wet gas from the metabolism, leaves the blood. Reduced lung function means that the ability of lungs to exchange gases is reduced. The lungs are a pair of large, long organs found in the thorax lateral to the heart and superior to the diaphragm. Each lung is surrounded by a pleural membrane that provides the lung with space to expand as well as negative pressure space relative to the body's exterior. The negative pressure allows the lungs to excessively fill with air as they relax. The left and right lung are slightly different in size and shape due to the hair pointing to the left side of the body. The left lung is therefore slightly smaller than the right lung and is made up of two legs, while the right lung has three legs. Okay? This is of respiratory system. First, viral infection. Much can be done for viral infection. According to two practices for monks, antibiotics are not effective in treating viruses, and the best thing to do is just rest, he said. For most healthy individuals, the most common respiratory ailment they may face is an infection, said Dr. Matthew Excellent, a pulmonologist and critical care expert at the Ohio State University Wexner Medical Center. A cold is the first symptom, possibly accompanied by a fever. This is the presentation of the material for me. I return it to the moderator. Thank you.
Thank you, Umi Haryati. Next turn is time for the last speaker. Please welcome my friends, Adela Ayu Amelia Putri Kusnanto. The floor is yours.
Okay, number 2, asthma. Asthma is chronic inflammation of the lungs, airways that causes coughing, wheezing, chest tightness, or shortness of breath, according to Tonya Winders, president of the Allergy and Asthma Network. The signs and symptoms may be worse when a person is exposed to the triggers, which can include air pollution, tobacco smoke, factory fumes, cleaning solvents, infection, pollens, food, cool air, exercise, semi-salt, and medication. Exercise can also induce asthma. More than 25 million people are 1 in 13 adults and in 12 children in the United States have asthma, according to the Center for Disease Control and Prevention, CDC. For some people, asthma is mild irritation, but for others it can be a life-threatening condition, according to the Mayo Clinic. Asthma cannot be cured, but its symptoms can be managed. Early identification and treatment can prevent long-term damage and stop asthma from getting worse over time. Next. Number 3, chronic obstructive pulmonary disease, COPD. COPD is chronic and progressive disease in which the airflow in and out of the lungs decreases, making it harder to breathe. COPD is a combination of chronic bronchitis, inflammation of the bronchial tubes, and emphysema, damage alveoli. As the disease progresses, patients experience a shortness of breath and it can limit activity. Smoking is the leading cause of COPD. Over time, the airways of people with COPD become irritated and irregular, resulting in asthma. Smoking also, 1 in 10 people with COPD, experience asthma. Smoking is the leading cause of COPD. Over time, the airways of people with COPD become irritated and irregular, resulting in asthma. Smoking also, 1 in 10 people with COPD, experience asthma. Smoking also, 1 in 10 people with COPD, experience asthma. inflate and thicken, making it harder to American Lungs Association. More than according to the CDC. COPD has no cure, but it can be treated. Number 4, lung cancer. According to HES, there are two different types of lungs cancer. This is cancer that originate in the lungs of opposed to cancer that spread to the lung, small cell lung cancer and non-small cell lung cancer. The main symptoms for lung cancer are shortness of breath, pain, coughing up blood, and fluid in the lungs. Often associated with smoking, but the disease can affect non-smokers as well. It is the second most common cancer for both men and women, outranked by prostate and breast cancer, respectively. The American Cancer Society (ACS) estimates that in 2021 there will be about 235,760 new cases of lung cancer, 119,100 in men, and 116,660 in women, and around 131,880 in men. That's for lung cancer. 69,400 in men and 6,270 in women in United States. However, the number of lung cancer deaths has been on downward slope. It risen just due to advance in treatment and early detection. Most people diagnosed with lung cancer are older than 65, and the average age of people diagnosed with lung cancer is 70. A doctor diagnoses lung cancer by performing imaging tests such as a CT scan, testing cough sputum, and lung biopsy. Treatment is based on the extent of the lung cancer, and with her is spread to other parts of the body. Treatment ranges from surgery, chemotherapy, and radiation therapy through to palliative care. Thank you.
Okay, thank you for Adela Ayu Amelia Putri Kusnanto. And thank you for the all speaker. Finally, we are come to the last agenda. We would like to say thanks again for the presenters and all the audience for active participation. The conclusion presentation today is the respiratory system is the network of organs and tissues that help you breathe. The human breathing process is divided into the two pieces, namely inhaling, and exhalation atau exhaling. The essence of this process is to bring in oxygen for the body needs and the remove carbon dioxide, which is the rest of the combustion in the lung. Hopefully the presentation will give benefit for us. Thank you for your attention. See you later. Wassalamualaikum warahmatullahi wabarakatuh.